This is Robert Miner, and this is my Vascular System TED Talk. The aorta stops where it bifurcates into the right and left common iliac arteries that lie above the top of the major muscles of the abdomen along the line running towards the center of the inguinal ligament. The common iliac artery will then bifurcate and give rise to both the internal and external iliac. The internal iliac arteries will provide blood to the gluteal region, urinary bladder, and female's uterus. The internal artery gives rise to the umbilical arteries during the fetal circulation. The common iliac arteries continue to the external iliac arteries towards the lower extremities. Once the external iliac artery passes under inguinal ligament to become the femoral artery. The femur will give rise to several branches on the way to the magnus muscle to become the popliteal artery. Among these branches are the medial and lateral femoral circumflex arteries. These arteries will supply blood to the hip joint as well as the muscles of the superior-most portion of the thigh. The deep femoral is the other branch of the femoral artery that will run deeper and parallel to the femoral artery. The femoral will continue to the popliteal artery as it passes through the opening of the abductor magnus muscle where it supplies blood to the knee. The popliteal has branches called superior medial genicular artery and inferior lateral genicular artery. Just below the bend in the knee, the popliteal becomes anterior and posterior lateral artery and extend to the foot. The anterior tibial extends along the shin to the top of the front where it becomes the dorsal pediis artery on the acral artery and then digital arteries in the toes. The posterior tibial artery will give rise to the branch as it descends through the leg called the femoral artery onto the medial and lateral plantar arteries on the foot. The arch of aorta has three branches, including the brachiocephalic trunk that provides blood to the upper right extremity as well as the right side of the head and neck. The second branch is the left common carotid artery that provides blood to the left side of the head and the neck. The third branch providing blood to the left upper extremities is called the left subclavian artery. The brachiocephalic is short and turns into the right subclavian artery and the right common carotid artery. The subclavian artery will extend laterally towards the corresponding upper extremity where it changes its name to the axillary artery. The subclavian will give rise to several branches. One of these branches is the vertebral artery and courses up the neck and supplies blood to the spinal cord and brainstem. The vertebral unites with the basilar, then the circle of Willis. Another branch is the internal thoracic artery that supplies blood to the ribs. The other two branches are the thyrocervical trunk and the costocervical trunk. The axillary artery extends into the arm to a point just inferior to the lower border of the tendon of the teres major muscle where it becomes a brachial artery, which courses down through the arm where it becomes an ulnar and radial artery. The most prominent branch of the brachial is the deep brachial. The brachiotic trunk provides blood to the right side of the head and neck. The left common carotid artery provides blood to the left side of the head and neck. The common carotid arteries extend up the neck to just below the jawline where they turn into the internal and external carotid arteries. The external carotid artery has 8 branches serving the neck and outside of the skull. The superior thyroid artery provides blood to the superior part of the thyroid gland. The lingual artery supplies the tongue with blood and the facial artery to most of the face. The mental artery supplies the chin, superior and inferior labial arteries, the lips, and the nasal artery, the nose. The optical artery provides blood to the scalp and the back of the skull, and the maxillary artery to the jaw and the roof of the mouth. The superficial temporal artery provides blood to the area of the scalp just inferior to the ears. The internal carotid artery is a branch of the carotid artery which provides blood to the areas of the head which is located in the cranial cavity. The ophthalmic artery sends blood to the eyes. The superior vena is formed in the union of the right and left brachioid veins. The brachiotic veins are formed by the union of the internal jugular vein and the corresponding subclavian vein. The beds in the lungs is the pulmonary vein. The Axillaris system is a group of veins that inferior venous cava will be formed by the union of right and left common lilac arteries. The coronary sinus will result from the uniting of small coronary veins that come from the heart muscle. Resulting from the merging and small veins coming from the capillary beds in the lungs is a pulmonary vein. The Axillaris system is a group of veins that will drain the walls and organs of the thoracic cavity. The hemoxylous vein will begin at the continuation of the left ascending lumbar vein. The tributaries can be divided into parietal and visceral tributaries. Parietal tributaries are veins that are draining the walls surrounding the cavity that include the parietal tributaries, lumbar, and thoracic veins. These will drain the walls of the lower back and the underside of the diaphragm. The visceral tributaries include the hepatic vein that drains the hepatic portal system. The right and left renal veins drain the kidneys and the left side of the paired organs. The right glomerular vein drains the testicles and the ovaries. The right adrenal vein will drain the right adrenal gland. The hepatic portal system of veins will serve to drain the organs of the digestion and the abdomen. This system will include the inferior mastocytic vein and drain the last half of the large intestines. The supramastocytic vein comes from the small intestines and the first half of the large. The dural sinuses are veins which will drain the brain and serve to drain the structures inside the cranial cavity. They will eventually drain into the sigmoid sinus that in return gives rise to the internal jugular. The internal jugular then unites with the corresponding subclavian vein to form the bronchiolic vein. Most of the veins that drain the face and the scalp have names similar to their corresponding arteries. Beginning in the forearm are the radial and urinary veins that unite with the brachial vein just below the elbow. The brachial helps to form the auxiliary vein and then becomes the subclavian vein. The internal jugular vein unites with the subclavian vein to become the bronchiolic vein, and this leads to the superior vena cava. The superior veins of the upper extremities are the saprophytic and basilic veins. Beginning at the lower portion of the leg, the anterior tibial unites with the posterior tibial to become the popliteal vein just below the knee. The popliteal veins tributaries are the genicular veins, help to drain blood from the knee area and then becomes the femoral vein. The femur will unite with the external iliac, then to the internal iliac vein. The right and left common iliac veins will unite to form the inferior vena cava. The superficial veins of the lower extremity are the two saphenous veins. The short saphenous vein begins with the lateral side of the foot and empties into the patellar vein.